Hi, Greg. How are you
Hi.
doing?
Okay.
If you don't mind, I'd like to start with a mindfulness exercise.
Okay.
Do you have your cell phone on you?
Yep.
Okay, go ahead and take it out. And I want you to find a picture of someone that you really, really care about.
Okay.
Let me know when you got that pulled up.
Okay, I got it.
Okay, and just for a little while, I want you to focus on that. If any intrusive thoughts or any judgments come into your mind, try and push them away like we've been working on. Okay? Go ahead.
Okay.
Any feedback? How did that make you feel?
Um, I remember I went to this wedding with my girlfriend. This picture of my girlfriend, and I just remember how she looked in this dress and how she smelled. How much fun we had at
Wonderful.
the wedding.
Good job. How did this week go for you?
Um, it didn't use this week.
Awesome. Good job.
But I had a fight with my girlfriend. And I cut myself afterward.
Okay. Can you tell me a little more?
Um, yeah, we just had this fight. I don't know. It was about money, and it got out of hand, and she left, and I ended up cutting myself. It just felt better.
Did you try and use any of your coping skills before you went to self-harm?
No, not really.
If it's okay with you, I'd like to use the remainder of the session to introduce some more coping skills based on dialectical behavioral therapy that we've been working on.
Okay.
Okay. So what I want to start out with is an introduction of tip skills. So there are 4 tip skills. The first one stands for temperature. So you're going to tip the temperature of your face with cold water. The second one stands for intense aerobic exercise. The first P stands for paced breathing. And the second P stands for paired muscle relaxation. Each skill has the effect of rapidly changing your biological response patterns and thereby causing a reduction in your emotional arousal. And there are several reasons that we use these tip skills. They can change your body chemistry. They can work very fast. So, within seconds to bring down this arousal that you're feeling and prevent relapse, prevent self-harm. They work like fast-acting medications, but without the side effects, without the expense. They're easy to use, don't require a lot of thinking, and it's something you can do in public without people even realizing that you're doing it, okay? So a few times when these skills might be useful is when you're caught in the emotion mind and you can't get out, like when you're in that situation with your girlfriend, or when you're feeling a craving and you're really, really triggered to pick up and shoot up. If you're in crisis, so if you have any urge to engage in a destructive behavior and there's no distraction from that. If you feel a lot of pressure, if there's a lot of demands that need to be met and you feel overwhelmed about that. Or if your other skills are not feasible to do or are not helpful. So maybe you've tried some coping skills. Maybe you've gone and listened to music. Maybe you've tried to call the sober support and they didn't answer the phone. So any of these times would be a good time to try and implement these tip skills. So the first one I want to focus on is tipping facial temperature with cold water. Have you ever heard of the dive reflex?
No.
Okay. So the dive reflex is a tendency in humans for the heart to slow down to below resting heart rate when the person is immersed in very cold water without oxygen. And the way that works is you put your full face into cold water, or you can put a Ziploc bag with cold water or filled with ice on your eyes and upper cheeks, and you're going to hold your breath. And this tells your brain that you're diving underwater, and it starts that dive reflex in your body. Your heart slows down, the blood flow to non-essential organs is reduced, and the blood flow is redirected to the brain and to the heart. This response can actually help regulate your emotions. I know that sounds crazy, but this has been tested and it is actually really effective. And this will be used as a distress tolerance strategy when you're having a very strong, distressing emotion. So when you're angry, when your anxiety is, at 100, or if you're having any urges to engage in self-destructive behavior. This strategy works best when you're sitting quietly. Activity and distraction may make it less effective. So if you are able to, go in a different room and try and apply this. Okay?
Okay.
So that's the first one. And I want to go ahead and move on. Vigorous exercise. I mean, that sounds pretty self-explanatory, but any examples of something you do to get aerobic?
Run sometimes.
Okay, running's awesome. So this intense exercise, we want you to try and do intense exercise of any kind for 20 to 30 minutes. And this can have a rapid effect on your mood, decreasing negative moods and pushing away those thoughts and increasing positive affect after exercising, okay?
Okay.
So anxiety decreases significantly if you get your heart rate to up to 70% of the maximum for your age. And if you'd like to, we can look that up for you before you leave, what exactly that is. The next one I want to take a look at is paced breathing. So paced breathing, it sounds really simple, but people don't really take the time to slow down their breath and actually think about it. So if we can just take a moment or so, I want you to focus on breathing into your abdomen. So pushing out your stomach, breathing in through your nose, and I want your exhalation to last longer than your inhalation. So do you want to pick a number and for inhale and a number for exhale that's longer than that?
Okay.
Okay, how many seconds did you choose?
5 and 8.
Okay, so go ahead and breathe in for 5 seconds. And exhale. Great. Again. Good job. And the last one I want to go over, we're not going to have time to go through all of it, but it's paired muscle relaxation. So paired muscle relaxation is a variation on progressive muscle relaxation, and this is widely used across many behavioral therapies, and it's very, very effective for anxiety. I know that we talked about doing some guided imagery or progressive muscle relaxation before falling asleep, when you're struggling with insomnia or anxiety, when you're trying to get some rest. Let's take a look at what this looks like. What I want you to do is go ahead and make fists with both of your hands.
All right.
Pull your fists up towards your wrists and clench them just 3/4 of the way. Pay attention to the tension. Notice the sensation in your hands. Notice the tension. Notice the tightness. Just notice. Now let go. Just let go. Let your hands drop down. Let all the tension flow out. Notice as your hands start to relax. Notice the muscles letting go. Just notice. Pay attention to the sensations in your hands and your wrists. Letting go all the tension. Letting it just flow away. Good. So we can do that with, several areas of your body. I'm going to give you a handout that you can use to practice over the next week. We just did hands and wrists. You can do lower and upper arms, shoulders, forehead, eyes, nose and upper cheeks, lips and lower face, tongue and mouth, neck, chest, back, stomach, upper legs and thighs, calves, and ankles. So they'll go over the combinations with you in this handout, and I'd like you to look that over and try and rehearse all of these skills that we practiced, okay?
All right.
All right. So you feeling good? Any suicidal or homicidal ideations over the past week?
No.
Okay. All right. Well, go ahead and try and use your tip skills, before you resort to those self-destructive behaviors, okay?
All right.
Good job this week on staying clean. I'm really proud of you.
Thank you.
You can go ahead and schedule on the way out.